Dialogues. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. New target identified that may prevent blood cancer. An international coalition of biomedical researchers has determined a new way to measure the growth rate of pre-cancerous clones of blood stem cells that one day could help doctors lower their patients' risk of blood cancer. The technique, called PACER, led to the identification of a gene that, when activated, drives clonal expansion. The findings, published in the journal Nature, suggest that drugs targeting this gene, TCL1A, may be able to suppress clonal growth and associated cancers. With age, dividing cells in the body acquire mutations. Most of these mutations are innocuous passenger mutations, but sometimes a mutation occurs that drives the development of a clone and ultimately causes cancer. The PACER technique for determining the passenger approximated clonal expansion rate was applied to more than 5,000 individuals who had acquired specific cancer-associated driver mutations in their blood stem cells called clonal hematopoiesis of indeterminate potential, or CHIP, but who did not have cancer. Study finds sex of blood donor to have no effect on recipient survival. A large clinical trial of more than 8,700 patients published in the New England Journal of Medicine concluded that the sex of a donor has no effect on the survival of recipients of red blood cell transfusions. The possible impact of the sex of a blood donor on recipient survival has been an unanswered question in transfusion medicine since 2015, when the American National Heart, Lung and Blood Institute identified it as a research priority. Some evidence suggested that sex-related differences such as hormone levels in male and female blood might affect recipient survival, but the results of the observational studies have been conflicting. To answer this question definitively, we needed a large randomized clinical trial, but those studies are incredibly expensive, said Dr. Michael Chassis, co-lead author of the study. He further added, by enabling this trial in real-world practice and using practical methods, we answer this question for a fraction of what a trial would normally cost. Tronexamic acid apparently does not prevent maternal hemorrhage after cesarean delivery. Tronexamic acid appears no more effective than placebo in reducing the need for blood transfusion or preventing maternal death in patients with increased risk for excessive bleeding because of cesarean delivery, according to a study published in the New England Journal of Medicine. Researchers assigned 11,000 patients to receive either intravenous tronexamic acid or placebo after umbilical cord clamping at the time of cesarean delivery. The study included women who had undergone scheduled and unscheduled cesarean delivery. The researchers reported the results as a single primary outcome of events that might be expected with postpartum hemorrhage, the need for a transfusion of red blood cells, or death. These events occurred in 201 patients, that is 3.6% in the tronexamic acid group, and 233, that is 4.3% in the placebo group, a difference that was not statistically significant. Study shows HIV, hepatitis B and hepatitis C could be detected from a single drop of blood. The most common test for hepatitis B, hepatitis C and HIV involves taking a blood sample from a vein using a needle. While this method works extremely well, there's a potentially large reservoir of the three conditions in places where this method is not suitable. This could be prisons, drug rehabilitation centers, and homeless shelters, where the taking of venous blood samples isn't always suitable, or countries in which the shipping and refrigerated storage of blood samples can be challenging. Alternatives include dried blood spot tests, in which a single spot of blood is tested for nucleic acid from the three viruses. Mr. Stephen Nielsen Moller and colleagues at the Department of Clinical Microbiology, Copenhagen University Hospital, Denmark, validated and assessed one such test. To do the test, the individual's finger is pricked and a few spots of blood collected on filter paper and allowed to dry. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.